Namaste, everybody, and welcome to today's Facebook Live program. Today's program will be about our distance learning here at the California College of Ayurveda. As you might imagine, during these difficult and unprecedented times, we're getting a lot of phone calls about our distance learning program. And we thought it would be a good idea for me to be able to share with everybody about our distance learning program, and that this might be the best way to answer so many of your questions. And through today's program, what I hope to do is be able to clearly describe what your experience will be like as a student at the California College of Ayurveda in our distance learning program. So I just want to take a moment to share with you a little bit about Ayurvedic education in general. The purpose of Ayurvedic education is to teach you how to bring the knowledge of Ayurveda to your patients, to your community, and really to the world. My great hope is that through Ayurvedic education, that we will be able to transform the consciousness of everybody here on this planet. You know, from the broadest perspective in Ayurveda, we could say that the suffering that's happening right now is related to the COVID-19 virus, or really any suffering, is the end result of being out of harmony. This is a fundamental principle in Ayurveda. Where there's harmony, there's health. Where there's disharmony, there's disease. So if we're experiencing disease, then there must be a foundation of disharmony behind that. And we live in so much disharmony on this planet. We have our global disharmony, we have our political disharmony, we have our personal disharmonies. And the role of Ayurveda really is to share with people a way of living and a way of being that takes us from disharmony back to harmony, from disease back to health. And so it is really my great hope that through Ayurvedic education, that you will become a part of that transformational process, helping everybody in our planet, in our communities, to be more harmonious and therefore to be healthier and to be happier. Now let's talk a little bit about distance learning. Of course, here at the California College of Ayurveda, we are principally a brick and mortar institute. We have a 15,000 square foot facility. We have classrooms, we have a clinic, we have an outdoor amphitheater. We have all kinds of facilities for our students here who come to the college and study Ayurvedic medicine here in Nevada City, California. But our programs are also broadcast live over the internet, and we have a special program. And the special program is what we simply call distance learning. So I want to first explain that there's a difference between our live internet program and our distance learning program. Our live internet program are the actual classes that are taught here at the college. Those classes begin every spring and every fall. And those classes are happening in the classroom with many students moving here from all over the world to study. And at the same time, they're broadcast so that some of our students are in their home participating in every class. And of course, the technology is such today that students in the classroom are able to raise their hand, they're able to ask questions, and there's the same type of interactive experience with the teacher that our students in the classroom can have. And so really about half of our students today are at home and half our students are in the classroom. And that is the live internet classroom. So that starts twice a year. One class just started in the spring and another class will begin in the fall. We also have those programs in full-time and weekend formats. Now, our distance learning program is different than that. Our distance learning program is a very special program. And the distance learning program allows students to study from home and to study with a little bit more flexibility. A little bit more flexibility. It is not a completely open-ended program. In other words, our distance learning program allows students, first of all, to start the first of any month. So you could start this pretty much at any time. You study from the same textbook. You study the same material as our students who are learning in the classroom. Instead of having a classroom teacher, you have a master teacher that we assign to you. So you have a teacher that oversees your education and that you develop a one-on-one relationship with. And you meet with that master teacher for about 3 hours every month. And you meet a little bit each week, and at the end of each module, you have a longer 1-hour meeting to go over the material. The teacher's job is to keep you focused on your studies, and to answer your questions as you go along. Our program is very, very detailed and very, very well developed. And so in the distance learning program, you're going to be doing the reading assignments. You have project assignments. You have practical assignments. You have homework assignments. And you'll be doing all of this in what we call a modular basis, which means you'll be completing the program one module at a time. How long does it take to do a module? It's set up so that a module is 1 month, about the same amount of time as our students study in the weekend program. But you can do it as quickly as 2 weeks. And so that would be the same pace as our students in the full-time program. And because it is a highly structured program, you do have to stay on schedule and on track with your work. But if you fall behind, you're allowed a 1-week grace period. After that, you start losing points for your final grade. So the purpose is not to have a completely open-ended program where you're just able to do it if you do it, when you do it if you do it, but rather a highly structured program that keeps you focused on your education. And like I said, you're in constant contact with your master teacher in order to stay focused and to have your questions answered. Now, the standards in the distance learning program are exactly the same as the standards in the classroom program. The learning objectives are exactly the same, and the tests that you take to make sure that you have met the learning objectives and the standards are exactly the same. You'll be taking those tests proctored. Those proctored exams can be given anywhere in the world. And so we have a mechanism that we utilize in order to make sure that your exams are proctored. And if you want to know more information about how that works, of course, we'll let you know. Our enrollment counselors will be able to support you and answer those kinds of questions, or the teachers will be able to answer those kinds of questions. But we assist you in making sure that we're able to administrate that. And so you're taking the same exams, you have the same learning objectives, and you have the same standards of learning academically as any other student in the academic program. Now, there's also a hands-on clinical component to studying Ayurvedic medicine. And so when you finish Ayurvedic Health Counselor 1, that's our first level academic program, and you may take CAS 1, which is our Clinical Ayurvedic Specialist academic program, and this is highly academic, highly clinical. After you finish these programs, you will go into your internships. In your internships, this is the hands-on part of your studies. And so your internship is set up so that you come to the college for an intensive that lasts 10 days. And during that time period, you're going to learn all the hands-on procedures for diagnostics. So you'll learn facial diagnostics. Of course, you'll have learned about it, but you'll be doing it in a group setting. You'll be learning facial diagnostics. You'll be learning pulse diagnostics. You'll be learning tongue diagnostics. And it's a very intensive hands-on learning experience. And then you have two options during your internship. You can either stay here in Nevada City and do your internship at our clinic. Our clinic serves our local community. That would mean that you have to move here, and many of our students do. They'll move here so that they can learn within a professional setting how to be either an Ayurvedic health counselor, a clinical Ayurvedic specialist, or all the way through to being an Ayurvedic doctor. Now, we also give you the option to do your internship in your own community. Just like you were assigned a master teacher for the academic portion of your program, you'll be assigned a clinical supervisor for the clinical part of your program. And technology being as amazing as it is today, we're able to use that technology in order to give you very close and very detailed supervision during your internship. In fact, no treatment is ever administered without the approval of your clinical supervisor. And during your internships, you'll be working with Ayurvedic medicines. And these medicines are going to be designed by you, prescribed by you in the counselor program, designed by you in the clinical program and in the doctor program, made at our pharmacy and shipped out to your patients. All of that happens under the guidance of your clinical supervisor. In other words, no medicines are ever given and no clinical care is ever recommended without it first being approved by your clinical supervisor. And in doing that, we're able to assure that you have the most outstanding supervision and education that is possible. So you have your choice. You can either do your internship in our clinic, or you can set up a professional setting in your own community in order to do your internships there. In your internships also, you will have the opportunity to receive a stipend for the patient visits that you see. And we'll go into that at another time. So now I've talked about the Ayurvedic Health Counselor 1 distance learning program, the Clinical Ayurvedic Specialist 1 distance learning program, and then you would move into your Clinical Ayurvedic Specialist internship and your Ayurvedic Health Counselor internship. Those are the two internships you'll go into before going into the Ayurvedic Doctor program. So at this time, what I'd like you to do is, if you have any questions, to go ahead and type those questions in. My assistant, Emily, is going to take your questions, and then I'll be happy to answer them. So at this point, I hope you now have a clear understanding of your options, your educational options. So one of your educational options is going to be to study in the classroom. Another educational option is to study live over the internet. And your last option is to do a distance learning program, which right now, because of the COVID-19 virus, we're getting inundated with requests for our distance learning program. And of course, that's the main reason why we've put this together for you. So I want to thank you all very much for taking the time today to listen to this live video. If you have any questions about our Ayurvedic education, you're welcome to contact our main offices, and you can find out information about us through our website at ayurvedacollege.com. And you can also call and you can speak to an enrollment counselor at any time, and they'll be happy to take your questions. Now, I did receive just a couple questions, so I'll answer a couple of questions before we end today. The first one is, what is the student-teacher relationship while studying in this manner, in this distance learning program? The student-teacher relationship is very, very close. You form a nice bond with your teacher because you'll be with them for about a year, and you're going to be meeting with them one-on-one every week. And so you're going to develop a very close teacher-student relationship, and they're going to guide you in so many ways because, education is not just about learning information, it's about applying it to your life. And they're there to support you through that process as well. Another person asks, how are you handling the hands-on practicum in this time of quarantined isolation? How are you handling the hands-on practicum? Yeah, it just repeated twice. So how are we handling that? Well, hopefully we're only going to have to handle that once, and that's coming up for our May is our next hands-on practicum. And we are redesigning that program right now so that we're able to do that through breakout sessions, through practice sessions with people who are going to be far away. So we have actually designed that program. The May internship intensive is happening. And if you're in that internship intensive, you'll be receiving notice this week about how that is going to be administrated. However, for those of you starting your education now, we anticipate that you'll be able to do your practicum as a part of your regular education, and you'll be able to come here. Of course, we have no idea how the COVID-19 virus will change our society as a whole. And will it be that we find that the standards can be maintained through entirely distance learning? Then, of course, we would go ahead and we would implement that as an option as well, and then not require students to come for their practical intensives. However, it is difficult to imagine that scenario happening for every facet of the education. But for much of it, I do believe it can take place. And so we are learning as we go along. But for our May intensive, we'll most definitely be continuing to move forward with that so that our students, our regular students who are ready for their internships, will be able to continue forward on their education. And there's another question here. Do we have guidance on how to set up a practice? The answer is yes, you do have guidance on how to set up a practice. In fact, one of the strongest parts of our education is your business training. And so during your internship, you do receive business training. You will be doing everything from writing a business plan to learning about the physical, emotional, and spiritual aspects of becoming successful. In addition to that, there are very clear guidelines on how to set up your practice in your own communities. And so you will be fully supported through that process. And students have been doing that here at the college for 20 years. And so we have not had any issues with that at all. In fact, it's really a beautiful option for so many of our students. Let me just scroll down here and see if we have any more questions that have come in. A question comes in that says, "Hi, I'm from New York. Where will I do my internship in my community? Do I have to get my own clients? How many?" Oh my gosh, so many questions. And where? My house? Okay, let me answer those questions. So first of all, of course, you can come to California and you can do your internship at our clinic. So let's just make that really clear. You always have that option. And so as far as your internship goes, you will have the option to set up an office in New York if you're in New York in order to do your internship in. It just has to be a professional setting. Many of our students will rent space from a chiropractor, an acupuncturist. Any professional space will do. There are fees obviously associated with that, but you also will be charging your patients for your patient care. And we go over how all of that works during your internship. We've tried to model it based on what is sometimes done in various psychology internships that psychologists go through when they're doing internships out in the field. So it's called a field internship, and there is a mechanism for that for those who are unable to come to Nevada City in order to study. And you do have to see 50 patient visits during your counselor internship. You have, I believe, 60 more during your clinical internship, and you have 125 more during your Ayurvedic doctor internship. All right. Another question came in. What is the internship and working? What is the internship? Well, I think I've talked about that. And working alongside a medical doctor. Well, you could work alongside a medical doctor, a chiropractor, an acupuncturist, or on your own during the internship. Remember, you're going to be assigned a clinical supervisor. And your clinical supervisor is going to be either a clinical Ayurvedic specialist or an Ayurvedic doctor. And they oversee every single case. Remember, there is never a situation where a patient care is administered without it being approved first by your clinical supervisor, who will be an Ayurvedic doctor in many cases or a clinical Ayurvedic specialist. All right, I hope I've answered all your questions at this time that are coming in. It looks like I might have a few more. Let me just take a look here. I've applied to test out of level 1. If I do, what are the levels I have to complete to go through to the doctoral program? Well, level 1 is the Ayurvedic Health Counselor academic program. Following that, you would go into the Clinical Ayurvedic Specialist academic program. That's called CAS1. And then you would start your internships, and you would go into your Ayurvedic Health Counselor internship, which is your preventative medicine internship. And then you would go into your clinical Ayurvedic specialist internship. That's your clinical medicine internship. And then from there, you go into the Ayurvedic doctor program, which is going to be an additional year. And during that time, you have additional academic studies and you have additional clinical hours as well, clinical internship hours that you'll be fulfilling at that time. During that program, for instance, during the Ayurvedic doctor program, you'll be taking your classes in research methodology and laboratory diagnosis and interpreting it from an Ayurvedic perspective. You'll also have classes in pediatrics and geriatrics and many other classes during the Ayurvedic doctor program. So it kind of completes your clinical studies at that point. The Ayurvedic doctor is really the bridge between Western medicine and the alternative health Ayurvedic community. They have the deepest understanding of Ayurveda, and they also have the deepest understanding to be able to interact with the medical doctors as well. And so that's the role of the Ayurvedic doctor here at the California College of Ayurveda. And another question, I go full-time online, question mark? I think it's can I go full-time online so I can finish the course like a full-time student? Remember, as I said earlier, you can finish the course, finish a module in as short as 2 weeks period of time, and that would keep you on the same pace as our full-time students if you wanted to do that. How is the process of relocating to Nevada City for a family or single people? Are there any good employment opportunities? Well, we are a small community, and there are certainly employment opportunities, but it always depends upon what field you're in. It's not as big a community as a place like San Francisco. Relocating is beautiful. You live here in the mountains. It's a lovely Sattvic community. Many people move here. I'll warn you, some of them don't move back because they love it here so much. It is an absolutely beautiful community where people have a very high quality of life. So you could explore that, and our counselors can give you more information. And I believe that that concludes our questions for today. Let me just scroll down one more time and see if you have any here. I'm not seeing any. So I want to thank you for taking the time today to learn about our program. Go ahead and give the college a call and talk to one of the enrollment counselors who could certainly answer the more detailed questions you might have about tuition payment programs. We also have scholarships available for some students. And so students who qualify might be able to gain some financial aid. We set aside money every year for student scholarships. And so you can also ask questions about that. Many blessings to all of you. I want to just acknowledge your heart, because I know that without your heart, you wouldn't be studying Ayurvedic medicine. And together, through awareness and through the opening of our hearts, may we all participate in transforming the health and well-being of our communities and of our planet. Many blessings. Namaste.